Hearing loss is a natural part of the aging process. It is when the hair cells in your ears start to die away due to age, noise exposure, and just general wear and tear. When this happens, you'll start noticing that you're missing a few of the softer sounds in life, and you'll also start missing some sounds in conversations. Now, it's not so much that you're going to start noticing that you're missing those sounds, but conversations will become more effortful and more exhausting. This becomes especially evident in noisy situations. So going to your favorite restaurant 5 years ago was an enjoyable experience. Now it's much harder for you to maintain a conversation with the person across the table. And that's because your brain has to work overtime to overcome the hearing loss and block out any additional noise that it could previously do much more effortlessly. So it's probably the most common sign I see of hearing loss is difficulty hearing in noisy situations. Now, we might think we can get away with the hearing loss, but family members tend to pick up on untreated hearing loss pretty quickly. Family members will start speaking a lot louder than they used to, or they'll notice they'll have to repeat themselves more often, or they'll notice that the person with hearing loss isn't as engaging in conversations as they once used to be. And this makes for a lot less enjoyable conversations, both for the person with hearing loss and their family members. This usually results in less frequent interactions. So you think about that noisy situation, which is no longer enjoyable, and less enjoyable interactions with family. It's not uncommon for people with untreated hearing loss to become more introverted. Now, this often changes once we treat the hearing loss. So if we treat the hearing loss, social gatherings become much more enjoyable, and so this introverted behavior can be reversed. The other important factor to talk about with hearing loss is the brain. So hearing doesn't stop at the ears. That information goes up to the brain where it gets processed. And if we have hearing loss, not all that sound is going up to the brain for processing. So we're not stimulating the brain as much as we did before the hearing loss. And the brain has a use it or lose it response. And so if there is a hearing loss and those nerves are not treated, those nerves are going to start to get recycled by the brain. And the longer you have the hearing loss, the less the nerves are being stimulated, the more the brain will atrophy. In fact, treating hearing loss is the #1 modifiable risk factor for preventing dementia and cognitive decline. So the big question is, how do we treat the hearing loss? And that's with hearing devices. So the hearing devices are programmed to your hearing loss so that all the sounds that you're missing become loud enough for the brain to be able to process. Additionally, the background noise is filtered out with hearing aids. Think about Thanksgiving dinner. The hearing aids are going to focus directly in front of you so that you can hear the person that you want to speak with, and it's going to drown out all the sounds around you. So all the dishes clanging, all the water running in the kitchen, that usually become very distracting and can make listening challenging. So the hearing aids make conversations more comfortable and more enjoyable, both for the person with hearing loss and the person they're talking to. So hearing loss doesn't just affect the ears. It affects the brain, your relationship with others, your emotional well-being, and your lifestyle. But it is treatable. And the sooner you treat the hearing loss, the sooner you can get back to regular life.